It's a lottery, you don't know what you're getting, and it could just destroy your life.
I'm treating a good handful of conditions with one medicine now. Prior to that, I was taking 11 forms of medication.
It's absolutely clear that the medicines that we prescribe are having a life-changing impact on the lives of our patients.
The distinction between medical cannabis and street cannabis is massive. Medical cannabis is very carefully cultivated and it's monitored, it's a controlled drug, it's a medication. I absolutely wouldn't support or recommend anyone take street cannabis. It's a lottery, you don't know what you're getting, and it could just destroy your life. Is it cannabis? Does it still have the profile that the cannabis plant should and does have in other contexts? Because it's grown to get people to buy it again without any kind of ethical standards to it. It's grown under artificial conditions, not by people who really, not by farmers, cultivators who know what they're doing. Also, stuff is added to it that should have nothing to do with cannabis and is not fit for human consumption. Unbeknownst to them, they're taking something that is more like a Class A drug. Most people that have tried cannabis before feel that they're quite experienced with it, they know what they're doing, because they've accessed illicit cannabis for years. And no one believes me that it's completely different. And then the second time I meet them, they come back and say, "You were right. It's completely different. It's cleaner, it's clearer. I feel better. I don't feel impaired."
What we're seeing is these patients have been through a wide range of traditional medicines which have failed, and the feedback that we're receiving both from the patients and our prescribing doctors is that cannabis-based prescription medicines have been very effective in helping them manage those conditions. Pain is quite a generalised category which is made up of a number of different conditions, which can include arthritis, sciatica, back and neck pain, fibromyalgia. The list is quite extensive, and it's absolutely clear that the feedback we receive is that the medicines that we prescribe are having a life-changing impact on the lives of our patients.
Traditional medicines, I've had a lot of bad side effects. I don't have any side effects from medical cannabis. I used to take a lot of really strong pain medication. I was on things like Oromorph, codeine, tramadol. I'm able to now not have to take any of that and just basically use the medical cannabis, and really has changed my life massively. I'm able to just have more movement in my body when I get really kind of stiff and uncomfortable. It helps with my sleep also, and sleep is a big player with a lot of my conditions. So if I'm not getting the sleep that I need, my conditions will just be a hell of a lot worse. There isn't the addictive sensation, like I need to have this medicine, which I found with some of the stronger painkillers like tramadol and things like this. There's definitely an addictive pull to them. Medical cannabis is a lot more of a cleaner, organic approach to medicine, and I think it works with my body personally really, really well. I feel the most well I have felt in years by dropping the traditional medicines and taking the alternative approach.
The most important issue to grasp is that it's such a broad treatment. Most other treatments are developed and targeted at particular symptoms in particular disorders and licensed for that. It targets the whole system, which is a recognition of the fact that the whole system is really complicated. With any condition, you can't just feel better changing one brain chemical, because they all interact and they all depend on each other, and then they depend on your hormones, and then they depend on your enzymes that are there to balance the whole system. So what medical cannabis does is it actually takes advantage of that systemic treatment need, and by amending the availability of cannabinoids, then that's how it works, by rebalancing systems, not just increasing availability of one brain chemical. Conditions don't come with one symptom. They affect the way you feel, the way you think, the way your body functions, your daily routines. So there's so much that needs to improve in people's experiences. So the way medical cannabis treats those conditions through this system effect by rebalancing systems that are needed for all the thinking and all the feeling and all the regulation that we do every day. Most of the time we do it automatically, we don't know we're doing it. It happens unconsciously. Only when it breaks down that you do notice it, that's not working anymore. So the way it treats those symptoms via this systemic effect, functioning as a whole improves. So the symptoms just improve with it, if that makes sense. Mood and thinking go up or down together. If you're more anxious, you can't think straight. And if you feel too low, you can't think straight. So when your mood is up, that's when you're functioning the best. You're in the treatment zone again, and you just keep them there, and it doesn't happen again.
I'm treating a good handful of conditions with one medicine now. Prior to that, I was taking 11 forms of medication. The stigma there is massive. A lot of people are uneducated about how beneficial medical cannabis is and how it could benefit such a broad range of conditions. A lot of people still are stuck in the dark ages, whereas cannabis is a stepping stone to other drugs, and it's addictive, it causes mental health problems, and I think that really is a load of nonsense. Basically, because I can honestly say that nothing but positive has come from me using this plant as medicine.
There have only been a handful of people who have been prescribed cannabis via the NHS, and there are clearly hundreds of thousands, if not millions, more people who could be provided this as an alternative treatment option. The feedback that we've received from these patients during the onboarding process is that access to the medicines that they need have been challenging, and in the main they've been largely ineffective. I think there needs to be more of an effort to understand what the real issues are. I've seen recent articles in the press which suggest that private clinics are the reason why NHS isn't prescribing. The two are completely uncorrelated. Given that medical cannabis has been legal in the UK for over 6 years, I'm shocked that access and understanding around the medical benefits are still so limited.